Good afternoon. Today we will discuss СBL Squirrel in a wheel. Here is we must do introduction, tell about introduction, distribution by teams, and define rules. In first part, objective of the lesson to promote the development of independent critical thinking in students when diagnosing and choosing treatment tactics for most frequently diagnosis in cardiology. After this lesson, you will be able to properly interview the patient and complete medical documentation, conduct a detailed questioning of complaints, a history of current disease, and complete life history, conduct a general examination, and list the main and additional research methods, and also justify the diagnosis and make a preliminary diagnosis. Name the teams and assign. First of all, we will assign a group leader in each team, Angela, Tarif, and Zuhair. Yes, team number 1, team number 2. Time manager, also one student. Yes, time manager, and reporter, also one student. Here is you can see 4 parts. In each part, you will have 3 questions, and totally 20 points in each part. After this additional score, 20 points, and overall 100 points. The teacher evaluates each team according to the criteria. Maximum score 20 points. It depends of time management, 5 points. Balanced participation, 5 points. Effective interpersonal communication, 10 points. It is additional score. Next, it is a patient, name of patient Sirik. A 58 years old man works at a stock exchange broker, carries out transactions that investors conclude he experiences great stress every day, sedentary lifestyle while working in the office, sleeps poorly since there are transactions on the stock exchange at night, and therefore consumes 5-6 mugs coffee every day. After a tense but successful day on July 9th of July, he went with colleagues to a bar where he celebrated a deal every Friday. After extreme excessive alcohol consumptions, he started having nosebleeds and a severe headache of a pressing nature. Question of part 1. How does a doctor begin questioning a patient? How complaints and medical history are detailed? And third question, what risk factors for the disease are important in the analysis of life? You can discuss. Question. How does a doctor begin questioning a patient?
First of all, the doctor will introduce firstly to the patient. Hi, I'm your doctor and my name is this. After that, the patient, doctor will ask the patient, how are you? And what's your name and what is your age? After that, what brings you here? So then the patient will answer all of the questions. After that, I will ask the patient, what is there any medical history? Is there any the patient will answer what brings him like to my clinic. After that, I will ask him like is there any medical history? Is there any pathological disease or something else? And after that, I will go for the complaints.
For the complaints, we will ask the patient that how about his headache, like from the which side he is having headache. Because it's very important in our analysis about like the headache in morning or evening, about the stress management, like bleeding cancer being like from the bleeding is from one nostril or from the both nostrils, and it is like from the pressing or like without pressing is the nose bleeding.
First question.
So first question, how does a doctor begin questioning to a patient? So first of all, we're taking greeting to the patient, taking history, like name of the patient, age, how many years old he is, like date of the patient, like first symptoms that are started, and also ask about the post diseases, like he has a liver disease or any heart disease or lung disease. Liver disease, because I am asking the liver disease because he is alcohol consumption. Nosebleed, due to the nosebleed, I am also asking for the lungs disease. So he has the normal respiratory mechanism, or he has the normal heart rate or any hypertension, like these diseases. So for the second question, ask the complaints, like the complaints and medical history. The patient have a nosebleed and alcohol consumption and stress as a worker in exchange, and also consumption of lot of caffeine, and also have a hypertension and due to the overload stress. And for the third question, we have the risk factors, like he has consuming the alcohol, caffeine consume, and like he has a poor sleep cycle, he is not sleeping properly, and also that causes the hypertension due to the overload of the blood and consuming caffeine.
Was third question?
Yes.
Okay, thank you. The answers to part 1. If we talk about questioning, we must ask question full name, date of birth, how matters, place of work and position, date and time of access. Yes, it is example of answer questions. And complaints. Here is details the main complaints according to the following features. First, the nature of the symptoms. Yes, maybe for example headache, localization and prevalence, time of onset of pain, day, maybe night, seasonality, duration, how long it lasts, pain intensity, maybe no pain, maybe mild, moderate, severe, very severe, and intolerable. 5. The cause of pain, maybe it can be after physical activity, maybe drinking of coffee, emotional stress, pain at rest, how it is relieved, after medicine, after rest, maybe after massage. Answer of this patient, character of pain, oppressive, localization of pain in the occipital region, it's a date and time, and how the disease began, suddenly or gradually, what were its first manifestations, the significance on the environmental conditions, and second, current diseases, subsequent manifestations and development of various symptoms, periods of exacerbation and remission, maybe stable progression, results conducted previous research, laboratory tests and instrumental investigations, methods treatments used before contacting a doctor, including at the outpatient stage, medication, surgical, physiotherapeutic, spa, dietary and other effectiveness, and direct reasons of this appeal to the doctor, deterioration of condition, failure of previous treatment and clarification of diagnosis. Answers: height 170, weight 110 kilogram, body mass index 36.5. Okay, here you can see patient examination. What is the main moment? Also, it is you can in auscultation of heart. Heartbeat rate 95 beats per minute, blood pressure 180
by 110
millimeter mmHg. Okay, next questions to second part. Okay, first question, what is a normal blood pressure reading? What does an increasing heart rate indicate?
So normal blood pressure is 120 by 80 mmHg, and what increase heart rate, and here it is hypothyroidism.
80. So the increase in heart rate indicates, I think it's related to the cardiovascular system. It's not related to the thyroidism, because the thyroid gland is non-palpable. So in case of disease, it will be then palpable, I think. So according to us, it will be like atherosclerosis, because there is a hyperthermic state and there is obesity also, and there is an increase in the blood pressure. While in hypothyroidism, there will be the bradycardia. So totally, it's not hypothyroidism, and there is weight gain also. And what sections? Can I change the slide?
What sections represent the borders of the heart?
Can you change the slide?
Okay.
So the borders of the heart is externally unremarkable actually. So the apical impulse is palpable in the sixth intercostal space along the mid-clavicular line, and also there is the dullness in the cardiac these boundaries. Left border, that is 1 centimeters outwards from the mid-clavicular line. Upper border, it is at the third intercostal 1 centimeters outwards from the left edge of the sternum, and the right border is at the fourth intercostal, which is 1 centimeters outwards from the right edge of the sternum. So here the auscultation reveals the muffled heart sounds. So we have to see the augmentation of the second sound in the second intercostal space. That here also the beats are normal, rhythm is regular. Beats are 95 beats per minute. So we can go up to the 100 beats per minute or 95 beats per minute. It is totally normal. Rhythmic is heart is rhythmic, but the BP is 180 by 110. So this is the condition.
I think it is the left ventricle.
Yes, hypertrophy.
Second part. Blood pressure is the pressure of blood on the walls of blood vessels. The normal upper limit of systolic blood pressure is 139, diastolic is 89. The lower limit of systolic blood pressure is 90, diastolic 60. Blood pressure is considered elevated when systolic blood pressure above 140, diastolic above 90. The normal heart rate is between 60 and 100. And we can see tachycardia when patient has anemia, bleeding, hypovolemia, arrhythmia, and high blood pressure, chronic heart failure, and fever. Answers of second question. The left border is represented by the left ventricle, right atrium, and the upper one, it is left atrium. Left heart displacement. It went left and down, hypertrophy and dilatation of the left ventricle. To the right, hypertrophy and dilatation of the right atrium. Up, hypertrophy and dilatation of the left atrium. If it will be changed, it can be because of extracardiac factors. The high position of the diaphragm is a horizontal position of heart. Accumulation of fluid and air is a pleural cavity leads to a shift in the boundaries towards the healthy side. Also, atelectasis of the lungs and pericardial adhesions on the affected side. Third question. Accent of the second tone on the aorta is an increase in the second tone in the second intercostal space on the right and is observed in arterial hypertension. Assign a patient diagnostic examination plan, interpretation of the results of laboratory test, and instrumental research methods. You can discussion.
So first physical examination, cardiovascular examination, palpation, auscultation on heart and lung. We will do echocardiogram, chest X-ray, and ECG. That's all.
So second is the result of the lab tests. So CBC, that we will do the ESR will be increased, C-reactive protein will be increased, lipid profile we will do, there will be the HDL will be increased, LDL will be increased. Also we will do the blood sugar level test.
Because it might be the
yes, it might be the case of the diabetes.
Because the patient is
obese. And also, sir, then we have the research methods.
lipid profile.
Assign patient diagnostic examination plan. We will do palpation, auscultation, chest X-ray, maybe ECG, echo. And in the second question, interpret the result of the blood test. We will do the blood test, like we will see total cholesterol level, HDL level, triglyceride level elevated will be there, and we will do also glucose test for if the patient is obese. So we will check if the patient has diabetes mellitus or not. We will also do immunological markers like interleukin 6, and also there will be elevated CR, ECR, and ESR.
Okay. Next. It is the answers of third part. Yes, we talked about silver plane, general blood analysis by chemical test, total bilirubin, bilirubin, lipidogram, glucose, creatinine, urea, LPSP, ACG, FSCG, BP monitoring in 24 hours. What do you think about this general blood analysis? Yeah. Okay. In biochemistry, you can see which changed in biochemical tests.
Triglyceride,
LDL,
VLDL, glucose,
cholesterol
creatinine level
also,
that is 90,
okay.
urea will be also there.
main is the cholesterol,
ASTL also.
LDL and HDL.
Okay, urea coagulation. How you interpret this ACG? First thing.
The flaps are sealed the moment it might. Sir, we see the tricuspid, the flaps are sealed. That means
Movement is multidirectional, and in the mitral valve, the valves are not sealed. That means the movement is multidirectional, and also in the left atrium, that is not expanded.
conclusion is aorta is not compacted.
Yes, sir. The conclusion is there is aorta is the ascending aorta. It is not compacted or dilated, and also the contractile function of the left ventricular myocardium is not reduced. Ejection.
First thing, please interpret.
The study was conducted on outpatient basis. So during the monitoring, the following is recorded, like the severe systole, diastolic arterial hypertension during the day. It was during the day the blood pressure was 185 by 1 mmHg, and during the night it was 170 by 102 mmHg. But the maximum blood pressure during the day it was recorded as 198 mmHg, and diastolic was 131 mmHg. And during the night,
instrumental research methods. ECG.
So in ECG, there are QR is complex amplitude elevated in the elongated in the third lead.
And ST segment depression.
Yes, sir.
And T wave inversion in the lateral leads.
Yes.
The blood pressure is like 185 over 111 mmHg, and at night 170 over 102 mmHg. So it has a stage 3 stage 3 hypertension.
It is the answers. So we play ECG, FOCG, BP monitoring, glucose, and laboratory analysis. In interpretation of laboratory research methods, in general blood analysis and cardiogram, general urine analysis, no changes in biochemical, hypercholesterolemia, dyslipidemia, second B. Interpretation of ECG, sinus rhythm, 88 beats per minute, electrical axis of the heart in horizontal position. Detection of signs of arterial hypertension, it is diastolic dysfunction of the left ventricle type 1. Increase of indexed mass of myocardium left ventricle. For male, it is normal, less than 116, but for this patient more than 116, 117. Also, dilatation of ascending aorta is also possible, or an excess of comparison of the size of sinus left normally, by the sinus left should be 2 mm larger.
So identify the first question is identify the syndromes, determine the leading syndromes. So the syndromes are left ventricular hypertrophy, atherosclerosis, right ventricular hypertrophy, coronary artery disease, obesity, pneumothorax, massive pleural effusion, severe myxedema, massive atherosclerosis. Now, the second question is form a diagnosis and justify each word in the diagnosis. So the diagnosis is echocardiography, chest X-ray, electrocardiography, and pericardiosynthesis.
The first question was to identify the syndromes and determine the leading syndromes. So there will be the pain syndrome, there will be the elevated blood pressure, elevated BMI, which leads to the obesity, and dyslipidemia, and there will be the increase in VLDL and HDL, and there will be the
hypercholesterolemia will be there, HDL will be decreased, but there will be the increase in the LDL and VLDL. Also, there will be the hypertension, obesity, dyslipidemia, BMI is increased, weight is increased, and also blood pressure increase. Also, there is the pain. So, in the second diagnosis,
it will be the left ventricular hypertrophy, because justification we can say,
as there is the mass is increased, and also the MLV is 117 per gram, which is normal is 115, and also the mitral value is sealed there, aortic value is not sealed, and also the diastolic dysfunction of the left ventricle is there.
And also in the ECG there was the V3 and V4, it was increased than 35.
Yes, so when we talk about treatment, so we can give
answers of course parts. First, it is syndromes. Arterial hypertension syndrome is a leading syndrome.
Yes, sir.
Overweight and dyslipidemia.
Yes, sir.
Second, main arterial hypertension stage 3, risk 3, risk of cardiovascular disease, complications, heart failure first stage by New York Heart Association, related dyslipidemia second B, obesity of second degree, of alimentary constitutional genesis. Rational for diagnosis, main, it is stage 3 because BP more than 180 to 110, risk of cardiovascular complications 3 because there are arterial hypertension. Third stage, gender male, smoking, hypercholesterolemia, sedentary lifestyle, psychosocial factors, heart rate at rest more than 80 beats per minute. Here is a table of grade. Yes, more than 180, it is stage 3, and more than 3 risk, it is high risk. That is why high risk. Complications, it is cardiac heart failure, chronic heart failure first stage because no limitation of physical activity. Okay. Next, dyslipidemia second B, since the level of cholesterol, LDL, and very low density lipids are increased, the coefficient of atherogenicy also. Obesity of the second degree of alimentary constitutional genesis since BMI is 38. And treatment, first of all, non-drug therapy, nutrition correction, limit salt intake, reduce alcohol consumption, quiet smoking, increase physical activity, reduction of excess body weight, and stress management. What is a drug medicine? Calcium channel blockers and ACE inhibitors. It is the best combination. Purpose calcium channel blockers justified given the high risk of cardiovascular complications. The patient smokes, his father had a myocardial infarction, obesity second stage, hypercholesterolemia. ACE inhibitors are effective in combination with calcium channel blockers because they neutralize possible activation of the sympathadrenal system by calcium antagonists. Okay, that's all. Thank you very much.
Thank you.